think about Mirebalais, I think about the fact that we had no idea what it was going to be like to build a teaching hospital in rural Haiti from scratch, let alone a 300-bed tertiary care hospital with a CT scanner and a modern emergency room and modern operating rooms and all of these things. We had no idea what it was going to be like to build that from scratch and open it and run it. The very first time I came to Haiti was in August of 2009. I went on a mobile clinic, and I think about how touched I was by the experience of walking 4 hours to see about 1,000 patients and learning about that community, learning about the challenges just geographical to start. And then you layer on that the poverty, and you layer on top of that the education, and then you layer on top of that when someone gets sick and is 4 hours away from any health center, what it takes to actually get there. So it just made the reality of poverty and rural healthcare sink in a way that I will absolutely never forget. You can imagine that after the earthquake, there was a lot more focus in Haiti on emergency care. And I think the ministry, straight on down to your everyday citizen in Haiti, realized, gosh, we were really completely unprepared for this. And so what we're really trying to do with the emergency room at Mirebalais is be, again, more innovative about the model, be more efficient, and really train our generalist physicians as well as our specialists who work in the emergency room around, the right approach to triage, around how to use some new medications that are incredibly useful, about how to use a CT scanner. I mean, you can imagine having gone through all your training, not having this very, very transformative tool, and then coming to a hospital where you can get a CT scan just like that. Maternal and child health is absolutely one of the top priorities for Zame La Santé in terms of our strategic priorities over the next several years, as well as in terms of what the country actually needs. The volume of deliveries, the challenges around safe delivery, the challenges around neonatal health. These are all things that are incredibly important. If you envision and think about what the operating rooms look like in Cange, there are 2 small operating rooms. They're on kind of a 3rd floor, and unfortunately did not accommodate the volume of surgeries that the population needed. Mirebalais has 6 huge operating rooms that are built to incredible standards, that have quite a bit of space, that have modern technology around anesthesiology, around just the basic tools that we need, and we have the space now to be able to do a larger volume of surgeries to meet the population's needs. Our attendings and all of our clinicians were working at Mirebalais before the residents started. Once the residents started, everyone stepped their game up because, when you have trainees who are asking you questions and who are, very dynamic and energetic, they help everyone, the entire hospital, the whole culture of the hospital, to really take it to the next level. And so we are now establishing that culture of education and research and high quality care. The Mirebalais model and what it represents for Haiti is just an incredible thing, that we can actually get health professionals to move out of Port-au-Prince and to be excited about working in rural Haiti, that we can actually create a hospital that has sustainable energy options, that we have a hospital that integrates not just physician education, but nursing education and allied health professional education. We could not be more proud of it. We, again, still have a very long way to go. As we say in Creole, petit petits oiseaux fait nicher, which means, little by little the bird builds its nest, so we've still got a long way to go. But we've really taken a huge step forward with Mirebalais.